Hey, hey guys, it's Aaron Henson. This is my video forum for Social Work 290, the online video forums. Um, this week we had to post a forum as a response to the um, a TED Talk that was on mental health awareness and basically a call for change, a call for reform, and how essentially the breaking down the stigma that there needs to be more care, that there needs to be less waiting time for people that struggle with things like anxiety and depression. And I thought she made a lot of good points. It was a lot of personal testimonials about one of her friends who had crippling depression and couldn't get seen for 5 months, and couldn't in that case then overcome her depression. And so her whole thing is that she started an online thing or a consortium of doctors and like self-help groups and stuff like that. And so her video is essentially just a call for change. And I think she makes a good point. That there definitely needs to be change in the system. One thing that I would kind of push back on is that depression and anxiety and mental health are not always, it's not always something that you're predisposed through genetically for or things like that. And so I think that one way to really decrease, because she was throwing out numbers of the amount of people that are depressed in the United States and in Europe and developing countries. And I think that one way, instead of just medication, she mentioned CBT, cognitive behavioral therapy, a little bit. I think that's great. But I think realizing that mental health usually is sourced from something else. So I know personally in my life, I've gone through depression. I've struggled with it, and I know that the times that I enter into those times of struggle are because of a behavioral pattern, or I'm isolating myself, or I'm in a certain situation that I've chosen to be in, and it was a choice that I made that ended up in that. And a lot of times, depression, I know you can't, depression and anxiety, you can't control. But I think a thing that we need to go in as well as much as providing care for people that are struggling with it is educating people on circumstances and life and perspective and how to view life that can kind of take away some people's predisposition for struggling with these things. And I know some of you guys might push back on that, but I realized that for myself, it was because I was totally self-absorbed and self-seeking, and realizing that if I'm not giving myself to something greater than myself, then I'm not going to ultimately be able to satisfy myself. And so I started putting all the weight in the world on people's opinions of me, and it was just so degrading. And so when I had a perspective change, when I had not a circumstance change, but a perspective change of my circumstances, then I started seeing things in a different light. And so I think that we also should look to educate people who are struggling on perspective changes and on that, instead of just accepting that's just the way that you are. So that would be my 2 cents on what she's talking about. I definitely agree. I think that the healthcare industry needs to do much better. I think we need to destroy the stigma. But I also want to take that further and say, I think we should educate people on self-help patterns, instead of just instantly when you start struggling, you go to someone else, but be able to be introspective and look and say, how can I change my perspective? And a lot of times it is, depression can be like severe and definitely something that needs to be helped. So I'm not saying you shouldn't go for help, but I think that a lot of depression in my life, it was self-wrought. And so I think if I had been taught how important perspective is and things like that, then I might not have struggled like I did. But that's my 2 cents. Feel free to disagree. I'd be happy to hear your comments.